Ladies and gentlemen, today we're going to dive into the fascinating world of neurosurgery and explore the remarkable differences between two procedures that might sound like they belong in a sci-fi movie, craniotomy and craniectomy. But fear not, my friend, for I, Dr. Lan, shall guide you through this complex maze with a sprinkle of humor and a dash of wit. Now, imagine you have a brain swelling or an infected skull. Not the most pleasant thought, I know, but bear with me. In such a dire situations, our brilliant neurosurgeons come to the rescue with their trusted tools and remarkable skills. They have two main options at their disposal, craniotomy and craniectomy. Let's start with the former, shall we? Craniotomy, my dear friends, is like the brain's version of a house renovation. You know, when you want to fix a leaky roof or an extra room to your humble abode. Similarly, during a craniotomy, the skilled surgeons make an incision in your skull and create a bone flap, just like opening a window to let some fresh air in. They carefully remove a portion of your skull, giving them direct access to the brain. It's like remodeling your house, but instead of adding a new room, they're adding a new pathway to your brain. Talking about an extreme makeover. But wait, there's more. Once the surgeons have finished their brainy business, they put the bone flap back in its rightful place, like a puzzle piece fitting perfectly into the grand scheme of things. It's like they're saying, "Hey brain, we fixed you up, good as new." And voila, your craniotomy is complete, leaving you with a lifted scar to show off at parties. Who needs a tattoo when you can have a brain surgery scar, right? Now, let's move on to craniectomy, the rebellious cousin of craniotomy. Picture this. You are tired of conforming to societal norms, so you decide to go all out and embrace the unconventional. Well, that's exactly what craniectomy is all about. During this procedure, the surgeons remove a portion of your skull and leave it out. Just like a rebel without a cause. It's like saying, "Skull, you've been holding me back for too long. It's time to break free." But why, you may ask? Well, my curious friends, craniectomy is often performed when the brain is experiencing severe swelling and it needs room to break. By removing a portion of the skull, the brain can expand without any restrictions, like a balloon filling up with air. It's like giving your brain a little vacation, a chance to stretch its metaphorical legs and enjoy the freedom of space. Now, you might be wondering, what happens to the poor skull flap that has been left out? Fear not, my friend, but the surgeons have a plan. They carefully store it away like a precious artifact, keeping it safe until the brain decides it's time for renewing. In some cases, they might even use a synthetic material to replace the missing skull portion. It's like giving your brain a temporary vacation home, just in case it wants to come back and visit someday. So, there you have it, folks, the remarkable differences between craniotomy and craniectomy. One is like a house renovation, adding a new pathway to your brain, while the other is a rebellious act, giving your brain the freedom to expand. Both procedures are like a dance between the surgeons and your brain, a dedicated choreography that aims to restore balance and harmony. But remember, my dear friends, these procedures are not to be taken lightly. They require the expertise of our brilliant neurosurgeons, who dedicate their lives to unraveling the mysteries of brain. So, the next time you hear someone talking about craniotomy or craniectomy, you can impress them with a newfound knowledge and maybe even crack a joke or two. After all, a little humor never hurt anyone, especially when it comes to brain surgery. Thanks for listening.